My name is Holly. I'm from Invercargill. It's a small city at the bottom of New Zealand, and I am a single mum to a boy called Ambrose who is 5 turning 6 in October. I was recently diagnosed with primary myelofibrosis in September of 2023, and just been navigating life as a single mum and just dedicating my time to him. My first real experiences, my first real symptoms of primary myelofibrosis basically starts back in 2021 in April. I was 32 weeks with my daughter, and I started getting pain in my right calf and just throbbing pain, so I was getting constant massages just to try get rid of it. Initially thought it was preeclampsia, so I didn't really think much of a big deal. I was also experiencing extreme fatigue a lot throughout the pregnancy, and then one day I was in the supermarket and I started getting a lot of pressure in my abdomen. Didn't really think much of it. Went home, and then I started having contractions around 9 p.m. and they lasted until 3 a.m. and I started experiencing fevers and sweats, and because I had had such a horrible experience with my previous midwife with my son, I left it and I didn't want to bother my current midwife. And so then I'd contacted her in the morning about it, and we went down to the hospital. She did an ultrasound and found that there was no heartbeat. So then I had to give birth to her naturally. And it was just a horrific delivery. Yeah, it lasted for a few days. After that, I was in ICU for about a week due to getting pneumonia. I had a really high heart rate. I had heart failure, and they didn't really understand what was going wrong. And then they'd found that I had a blood clot in my heart, in my lungs, and a DVT in that right calf. So I'm guessing all the massaging had possibly broken the blood clot off into different parts of my organs. So they also think that it caused my daughter's death. A blood clot had passed through my placenta, causing a placental abruption. So I left hospital, and then 2 weeks later I had a seizure and a stroke, and I was rushed back into hospital. They'd found that I had had a thrombosis stroke in my brain. So I was put on warfarin for over 6 months max, and then originally the hematologist thought that I had a blood clotting disorder. So she put me on warfarin, then took me off it for about a year just to see how my blood platelets were going to be, and they weren't coming down, they were rising. So that's when I started having my other symptoms, and they came on quite quickly because I wasn't on any sort of medication at that time. And I started just being extremely fatigued. I had really weak arms. I lost 20 kgs without even trying within 3 months. I started bruising like all over my body in the weirdest places, itching, rashing randomly, just constant shortness of breath. It was horrible, and I couldn't function at all throughout the day. And so then she'd sent me for a bone marrow biopsy. So when I went in for the bone marrow biopsy, I felt really numb to it all. I think because so much had happened previously, I was just in autopilot, like, okay, yep, okay, we'll do this, yep. After I got the diagnosis, I was absolutely distraught because I didn't know much about the disease at the time, and I didn't know anything about, if I was going to lose all my hair, or if I was going to have to take more time being away from my son. So many thoughts running through my head. They thought that I had it when my daughter had passed. It wasn't until a few months ago that they had sort of written it in doctor's notes, speculating that it had caused my daughter's passing and that I'd had it while I was pregnant with her. But yeah, the feelings around it, I was more so angry at the hospital and my midwife for not monitoring me closely enough, but I guess they couldn't really do anything about it. But yeah, it was a terrible, terrible time. I really lost myself. My relationship fell apart. I just wasn't coping. I had turned to drinking a lot, so that was like my self-medication while trying to be a single mom and trying to just push forward. And yeah, so when they had told me that they thought that I might have had it since I was pregnant with my daughter, I'd sort of already, I guess, yeah, I had a feeling. I had a huge feeling that it had caused it before they even said anything. So my treatment plan was to go on oral chemotherapy called hydroxyurea. So I started that. I was on 500 milligrams. My platelets weren't really doing anything, so they were going to double the dosage. And then a week later, I found out I was pregnant, and I was a mess because I thought, I'm gonna have to terminate this baby, and then they congratulated me, and then they put me on peg interferon. So I've been on peg interferon and aspirin throughout this pregnancy because I'm currently pregnant, and it's brought my platelets right down. I've been in normal range for the last few months, and I've felt the best that I've felt in the last few years, and everything's just looking amazing with this pregnancy. So I've been really privileged to have even, I guess, all of this sort of divinely orchestrated, I guess, because my blood platelets are right down now, being on peg interferon. So the immunotherapy injection, I do it myself on Sunday night, once a week, and yeah, and I'm also on Clexane as well, just to prevent blood clotting. I just mean with the side effects for the immunotherapy, I've had a lot of hair thinning, acne, a lot of fatigue, still really tired, loss of appetite. I don't really have much of an appetite. So the future treatment plan really is they want to take me off of it and just monitor me again until it starts progressing more, I guess. New treatment plans haven't been discussed with me at all because I'm pre-fibrotic with the primary myelofibrosis. So at this point, I don't have any bone marrow scarring. I just have a lot of fibrosis. So for now, they haven't discussed anything with me. And in terms of, I am open to other treatment if need be. In the beginning, when my mental health was really, really bad. I was thinking the worst of everything. But then over time, I think with this cancer, it's really taught me how resilient I am, and how much I've just trusted that whatever's meant for me is meant for me, even if the cancer does get worse over time. But it really has taught me to live in the moment, and live in stillness, and just be grateful for even the smallest things. And it's probably, yeah, it's been a huge challenge, but it's been one of the best things to happen to me in regards to my mindset. I feel like I can overcome anything as long as I just remain positive and just trust that things are just, yeah, it's gonna, yeah, that things will be, yeah. So now that I'm pregnant with, because I'm having another little girl, so now that I am pregnant with her, I have obstetricians monitoring me every 4 weeks. I have multiple scans, so I am 33 weeks at the moment, and I've had they've planned all these scans to make sure that everything's fine. I have phone consults with my hematologist, monthly blood tests, and my midwife. She's amazing. She was like, "Don't worry if you have an issue, just ring me and I'll come down in the middle of the night. We can check." She's very, very onto it, and always happy to do extra tests and scans and things to make sure that everything's good. So they've really looked after me now this time around. I guess my message is, you know your body better than anybody else does. If you have an inkling of whether you're pregnant or you may have cancer, if you have an inkling, even just an inkling that there's something wrong, don't try and people please. Put yourself first and go and get it checked.